Okay, we'll talk about children with malignancies or childhood cancers. We're not talking about specific cancers here. We're going to talk about just general findings, warning signs, and symptoms of a malignancy in childhood. General findings would be unexplained weight loss, fever, fatigue, pain, skin changes such as itching, darkening, reddening, or hairiness. Other general signs, change in bowel or bladder habits, a non-healing sore, unusual bleeding or discharge, thickening lump in the breast or other part of the body, indigestion or difficulty swallowing, an obvious change in warts or moles, and a nagging or persistent hoarseness and cough. These can be signs and symptoms of other things other than cancers. That's why a lot of parents will report that they feel guilty because they didn't find the malignancy or the cancer sooner. But as you can imagine, I mean, if your kid has unexplained weight loss, fever, and indigestion problems, you may think that they just have a bug or something to that nature, not necessarily cancer. So some of the specific signs and symptoms of different cancers that kind of stick out is for a Wilms tumor, there will be a painless, firm, non-tender abdominal swelling or mass, and hematuria. So this occurs because the tumor is actually located on the kidney in Wilms tumor. The child could have hypertension. Blood neoplasms, such as leukemia, so the child will have a paler color. They'll have increased bruising or petechia because there'll be an increased risk for bleeding. They'll have pain, headache, but there will be no tumor present because it's cancer of the blood cells, not an actual cancerous tumor. For bone tumors, there's non-specific bone pain, and this is often mistaken for growing pains. There will be decreased movements in the affected extremity. The child may walk with a limp. Diagnosis is made based upon the type of malignancy that it is. An ultrasound, an abdominal ultrasound can detect a Wilms tumor. A CT scan can detect a Wilms tumor, a neuroblastoma, bone tumors, or rhabdomyosarcoma. Patient education for a CT scan, if it's with contrast, you want to assess for allergies to dye or shellfish. The contrast can be given IV or oral. If it's oral, it may be hard for the child to drink. An X-ray or an MRI can detect bone tumors or rhabdomyosarcoma. A bone marrow aspiration can be used with a Wilms tumor, neuroblastoma, blood neoplasms, and bone tumors. Bone marrow aspiration in kiddos are usually done in the hip area. Biopsies, so surgical removal and diagnosis can be done with rhabdomyosarcoma and neuroblastomas. CSF analysis can be used for blood neoplasms to determine the CSF involvement, and this is done by lumbar puncture. So the child is usually put in a fetal position. Have them empty the bladder prior. Use a topical anesthetic cream about an hour before the procedure. Again, place in a side-lying fetal position. Assist the child in maintaining that position. Distraction may be needed. Sedation may be needed. Afterwards, a pressure and elastic bandage will be applied to the puncture site. Monitor the site for bleeding, hematomas, and infection. The child will have to remain in bed for 4 to 8 hours in a flat position, and this is hard for young kids. Remember, anxious parents don't hear well, so you'll have to repeat the post-op instructions probably over and over. Staging is used to determine the extent and progress of the malignant tumor, which aids in guiding the treatment plan. So are they going to surgically remove something, or they're going to recommend radiation or chemotherapy. Treatment, so chemo or radiation can be done to decrease tumor size. Chemotherapy destroys malignant cells. Each medication given for chemotherapy works differently, whether it interferes with DNA, inhibits new cell formation, or interferes with cell mitosis. Antibiotics can also impair DNA. It's usually done in multiple treatments, so it can affect cells at different stages of growth. Side effects of chemo are listed on page 258 and 259 of your ATI book, and I recommend that you look over those. Think about what the nurse can do to help with those unkind side effects, such as mucosal ulcerations. You can provide frequent oral care, keep lips moist. Skin breakdown, make sure you're repositioning frequently and doing frequent skin assessments. Neuropathy can cause constipation, so encourage fluids and high fiber. Neuropathy can also cause jaw pain, so think about the child being on a soft diet. The child may lose their appetite, so frequent I's and O's, small meals, and supplemental nutrition may be added. If they get nauseated, they may give a anti-nausea med prior to the chemotherapy, such as Zofran. Alopecia, because hair cells are fast growing, they're the most easily killed with chemo agents, so the child may be bald in 1 to 3 days after starting chemotherapy. Radiation and chemotherapy treatment has to be done in more than one treatment because we said it assures timing that they're getting the cells in the different stages of growth. Immediate side effects from radiation include sickness, nausea, vomiting, and anorexia. Long-term side effects include it damages all cells in its path, so it depends on the site of radiation. So if the radiation is done on bone, you could have asymmetric growth of the bones and risk for fractures. For hormones, it can cause thyroid disorders or growth hormone deficiency. For nervous system, it could cause learning disabilities and seizures. For the chest and abdomen area, you could have chronic pneumonia or pericardial thickening. It affects rapidly growing cells, so that's a separate statement, sorry. Make sure you tell the patient not to wash off the radiation marks. Don't use lotions or creams in the place where they will have the radiation. During treatment, reassure the child and the caregiver. Provide sedatives, a distracting game for older children because they have to lie still for the procedure. Complications, obviously the malignancy can metastasize. You can have kidney failure, skin breakdown, pancytopenia, which is bone marrow suppression. This causes anemia, neutropenia, and thrombocytopenia. This is in ATI on page 260. So malignancy, children with malignancies are at increased risk for bleeding, and they pretty much have no white blood cell count. So they're at increased risk for infection as well. So when you go into a child that's receiving malignancy treatment such as chemotherapy and you wear a mask, you're protecting that child. You're not protecting yourself because they have no white blood cell count. Again, they're at increased risk for anemia, neutropenia, and thrombocytopenia. So bleeding and infections is what you want to look out for. So in general, for malignancy in children, think about general signs and symptoms, and then those specific symptoms that we talked about for Wilms tumor and blood cancers. Then think about generalized side effects of treatment. So chemotherapy and radiation, they're pretty similar. What can we do to help, alleviate those side effects that the children may be experiencing? What are they at increased risk for? So infection, bleeding, things like that. Try to group them all together.